Hey, what's going on, everybody? This is Greg with sportsrehabexpert.com. Today we're going to be going over our 5 favorite strengthening exercises that all ACL rehabilitation rehab patients should be doing. You could also think about this as a strengthening program to prevent ACL tears in the first place as well too. So today we're going to be going over what those 5 exercises are, what they look like. Big key to all these exercises is you need to be able to do them in the gym, but also at home, because if you had an ACL tear, these are exercises in order to rebuild the capacity of our tissue up around the knee. We need to do them frequently and often, so you also need to be able to do these things at home. And if currently you're only doing things 2 to 3 times a week, the only days that you go to see your physical therapist or the only days that you go to the gym, then that's probably partially the reason why your rehabilitation may be taking much longer than it actually needs to. You should be doing something on a daily basis if you want to recover from the ACL injury in the fastest way possible. Keep in mind that you should never be working through pain. Depending on the type of graft that you may be utilizing, there are some different circumstances and expectations that you should be expecting when applying these exercises in your rehabilitation program, and that's important to why you consult with a trusted healthcare provider. We've also covered some of these concepts in a previous video when we talked about our early ACL rehabilitation goals, so be sure to check that video out as well too. But without further delay, we're going to get into the strength and conditioning aspect of the ACL recovery, what this looks like from about the 3-month mark on to about the 6-month mark. These are really important exercises that you should be emphasizing. But the nice thing about all these exercises is that many of them can be regressed and scaled appropriately to your current tissue capacity and tissue pain tolerance at just about any moment in time of your ACL recovery. So realistically, some people may be able to start some of these exercises as soon as 4 to 6 weeks after their surgery. Again, if you had a meniscus, MCL, or other type of complication involved with it, likely that's going to push the starting point of these exercises back a little bit further. But everybody should be starting these exercises at the very latest to some capacity at the 3-month mark. But again, if you've been diligent doing your exercises early on, this should start much sooner, possibly as early as 4 to 6 weeks. And that's again why it's useful to have a clinician who's had and seen a ton of ACL recovery patients, because they know how to scale the exercises appropriately so that you can start building strength and capacity within these movements much sooner.
So the first exercise is just a modified range of motion step down off of a box. This could start as simple as a 2-inch box early on, but then progressed up to 4, 6 inches to 8 inches is usually where I cap it out at. And anywhere that you feel like you stall out in the range of motion, then you start just progressing the weight and gradually load up the exercise more and more over time to when you're at the end stage of the rehabilitation, as again, you're working towards that 5 to 6 month mark, and even afterwards, you'd still want to be progressing the weight, trying to eventually get up to about 1 time your body weight in the hands with dumbbells or on your back with a barbell. The second exercise is taking the knees through more of a full range of motion. So we're dropping down into as deep of a squat as you currently pain-free feel comfortable. We do this on a slant board, again, really to emphasize the quad and the patellar tendon in trying to go through full range of motion squats. Body weight, again, if all you can do is mid-range of motion at this point in time, work to a point that you're currently comfortable, and this is why it's super important early on in your rehab process that you're really focusing on range of motion, as well as getting comfortable sitting the butt back to the heel, so you have that deep range of motion capability back by definitely 3 months, so you can start working through a full range of motion and then gradually start upping the load of the exercise with a goblet squat, holding a dumbbell in front of you, and then eventually getting to a barbell and putting weight on the barbell to load up gradually over an extended period of time. Now, you might not get to a barbell until the 6-month mark, but even after the 6-month mark, again, we're through a lot of the strengthening phases, but it doesn't mean the strengthening phase stops. This is going to be a lifestyle change for you for the rest of your life, where you want to maintain and continually progress the strength through a full range of motion. Even after the 6-month mark, even after the year mark, even after the 2-year mark, you're still going to need to strengthen that knee, which goes for everybody. It's not just unique to you because you have an ACL. Everybody should be capable of doing this and achieving this range of motion through load as as you strength train. And again, if you're experiencing pain or just struggling with the progression of the injury, reach out to me at greg@sportsrehabexpert.com, and we can discuss ways that we can work with you directly online. Now, the third exercise that's key from a strengthening standpoint is your Nordic hamstring. The hamstrings are super important because they share a similar role as the ligament of the ACL, albeit a muscular strategy, which we'd prefer to utilize over a ligament strategy to stabilize the knee in dynamic activities. So it's super important that your hamstrings are ultra strong, and it's going to be extra important to strengthen the hamstrings if you had a hamstring graft. Likewise, if you had a patellar tendon graft, it's going to be super important that you strength train the patellar and quad tendon. Now, the Nordic hamstring curl is the easiest way to start this by going through a modified range of motion. This is also why, again, you need to get comfortable kneeling butt to heel so that you can be comfortable kneeling on your knees when you do the Nordic hamstring curl. If you're not comfortable kneeling butt to heel because of the pressure on your knees, you're not going to be comfortable with the Nordics, and you're not going to be able to work the Nordics through a modified range of motion. But once you're comfortable putting pressure through the knees, you want to be working the Nordics through a modified range of motion, and then we can provide assistance to allow you to go through greater depth, and then you can work away from resistance over time. Now, again, I mentioned how this exercise, due to pressure at the knee, might be difficult for some to get to. So I'm going to give you a fourth exercise next, which also emphasizes the hamstring, which many people can start much earlier on in the process of strengthening their hamstrings, which is a stability ball curl. You simply put your feet up on a ball, roll the ball back towards you, and then control the ball back out into that lengthened position. Now, this isn't as strenuous as the Nordic hamstring curl. Likewise, you can use 2 feet to start, and then you can make it more strenuous by switching to one leg. One leg is challenging in and of itself for a lot of people, so that would be the standard and the goal, to be able to try to move towards single leg hamstring curl with the stability ball. And then the fifth and final non-negotiable exercise from an ACL strengthening standpoint, in my opinion, is going to be a split squat. Now, ideally, you're doing this with the foot elevated and you're using weights in either hand, but some people may find this a struggle and develop some type of knee discomfort going through this range of motion. So you can always modify the activity by reducing the load by bringing the step to a higher point. So this is a 12-inch box. A lot of people can do this in the stairway on the second step and perform the same split squat body weight until you can gradually work down to a 4-inch step or a plate on the ground body weight, and then gradually add more and more load over time. Very similar to the squats, we would expect you to continually progress this over the course of your rehabilitation, as well as continue this on past the year, past the 2-year part, and really keep this as a lifestyle.
There you have it, 5 key exercises for strength training after the ACL rehabilitation surgery. That's going to take you from 3 months on to 6 months, and realistically through a lifetime. And this isn't just for people who have ACL tears. This is for people in general. If they want to live a more athletic, active lifestyle, these exercises are going to be super useful for them through their lifespan, because they're all scalable. You can do them just about anywhere, and you can modify them accordingly depending on your levels of discomfort. And again, never working through pain. If you're experiencing pain or any struggles through your rehabilitation program, be sure to reach out to me at greg@sportsrehabexpert.com, and we can talk about how we can help you out online. Be sure to watch our previous video, which covered all of the early stage ACL rehabilitation programs, and then we're going to be back with another video that talks about end stage rehabilitation, return to play, and actually more sport specific plyometric based movements.